Hi everyone, we're from Group 6, and today we're going to present a case study. The case study that we're going to present today is a case study of a 64-year-old woman who was brought into the emergency room because of increasing shortness of breath and weakness. Her laboratory results, abnormalities, possible diagnosis, and treatment plans will be discussed.
Hi, I am Yuxin. Today I will be talking about abnormalities in the results and the differential diagnosis. In this slide, the patient's vital signs are being shown and shown that she has high blood pressure and a pulse rate that suggests tachycardia. Additionally, the respiratory rate is increased, which is known as tachypnea, and she has a slight fever. Physically, the patient appears very tired and pale, which suggests anemia, and jugular vein distension is being observed, which indicates increased pressure in the veins and a displaced heart apical impulse, suggesting heart enlargement. Clucking sounds in the lungs, fluid buildup in the abdomen, and swelling in the legs were also noted. In this slide, the differential diagnosis will be discussed with the patient's symptoms and medical history. Chronic heart failure is our top diagnosis as she had a history of ischemic heart disease and multiple small heart attacks, and the symptoms are shortness of breath, weakness, and swollen veins, where the heart isn't pumping blood effectively. Chronic ischemic heart disease could be exacerbating these symptoms, leading to more serious complications, and further diagnosis tests will need to be discussed. In this slide, each picture of a normal chest X-ray and the patient's chest X-ray is being shown here, and it reveals that the patient's chest is having cloudiness in the lower part of the lungs, likely due to fluid buildup known as pleural effusion. In this slide, the patient's biochemistry results show high levels of creatinine and bun, suggesting the kidneys may not be functioning properly, which can lead to high blood pressure. Elevated calcium levels indicate hypercalcemia, which can cause kidney stones. Low albumin levels suggest hypoalbuminemia, leading to fluid leakage from blood vessels, indicating possible kidney disease. Additionally, high BNP levels are indicative of heart failure. In this slide, the stool test results are positive for blood, suggesting internal bleeding, possibly from the digestive tract. A colonoscopy is recommended to identify the source of bleeding and to check for polyps or cancer. In this slide, complete blood count is being tested and the patient's lymphocyte count is on the higher end of the normal range, which might indicate an infection, autoimmune disease, or even cancer. It's shown that she has a low platelet count, known as thrombocytopenia, which can increase the risk of bleeding. Additionally, the red blood cell count and hemoglobin levels are low, indicating anemia. This can affect the body's ability to transport oxygen, leading to fatigue and shortness of breath. In this slide, a peripheral blood film is being used and it reveals a low red blood cell count and abnormal cell size, consistent with iron deficiency anemia, and a picture of the patient's blood smear and a picture of an iron deficiency anemia is being shown. In this slide, the blood gas analysis shows the patient has a blood pH of 7.26, indicating acidosis, and the PCO2 level is high, which suggests respiratory acidosis, likely due to pulmonary edema. The patient's PO2 and oxygen saturation levels are also low, pointing to inadequate oxygenation, possibly due to lung disease. In this slide, the tumor marker test shows elevated levels of CEA, suggesting a possibility of cancer, particularly in the colon or lungs, considering the patient's family history. In this slide, the ECG results show sinus tachycardia, which may be an early sign of heart failure, especially given the patient's history of ischemic heart disease. In this slide, the colonoscopy revealed a polypoid ulcerated mass in the ascending colon. This could develop into right-sided colon cancer, which often grows rapidly and has a higher risk of metastasis, as larger polyps have a higher risk of becoming cancerous. Lastly, in this slide, the histopathology findings indicate adenocarcinoma, a type of cancer that starts in the glands. The cancer cells are moderately differentiated, meaning they grow faster than normal cells but not as aggressively. Photomicrographs show these cancer cells and their characteristics, such as hyperchromatic nuclei and numerous mitotic figures. Next, I will pass it to Stella.
Now I'm going to talk about the possible diagnosis that we identified. First of all, pleural effusion. This is identified through the 4 points below. Cloudiness at lower part of the lung, which is caused by accumulation of fluid. Diffuse crackling at the lung bases. Body retains salt and water in an attempt to increase blood volume, and heart failure. Next up, heart failure. This is identified through inadequate oxygen pump to the body, increasing shortness of breath, weakness, reduced cardiac output and perfusion to muscles, and the presence of hypercalcemia kidney dysfunction. Thirdly, low to moderate grade colon cancer. It develops from the inner lining of the colon, preceded by growth called polyps. Lastly, iron deficiency anemia. This is identified through lethargic, pale, shortness of breath, and low levels of red blood cells, hemoglobin, HCT, MCV, MCH, and MCHC.
Now let's discuss the pathophysiology of colon carcinoma. Colon cancer typically starts from small benign growths in the colon known as polyps. While most polyps are asymptomatic and harmless, a small percentage can evolve into cancer if left undetected and untreated. Colon cancer's causes are complex, significantly influenced by a lifestyle. Risks include a diet rich in processed meats and low in fruits and vegetables, combined with a sedentary lifestyle, obesity, smoking, and heavy drinking. Additional risk factors include being over 50 and genetic predispositions like Inch syndrome and familial adenomatous polyposis. The progression from a benign polyp to invasive cancer involves a complex accumulation of genetic mutations and epigenetic changes. These changes allow tumors to grow unchecked, invading the colon wall and potentially spreading or metastasizing to lymph nodes and the distant organs. Finally, targeted therapies have proven to be very effective in treating colon cancer. By identifying specific genetic mutations, therapies such as anti-EGFR antibodies for KRAS wild-type tumors and immune checkpoint inhibitors for MSIH tumors can be personalized for effectiveness. Despite symptoms of colon cancer, confirming the diagnosis requires specific tests like a colonoscopy. This screening involves a flexible tube with a video camera that allows doctor to inspect the entire colon for issues such as swelling, tissue irritation, or polyps. Detecting these conditions during the procedure can indicate a positive result for colon cancer. This emphasizes the importance of regular screenings for early detection and effective treatments.
The form of anemia in the patient is iron deficiency anemia due to less of iron in the body. The cause of anemia in the patient is due to thermal ulceration will cause the blood loss in the GI tract, leading to iron depletion, and the colon cancer causes the inflammation, which will block the formation of red blood cell and cause anemia. So, the bone marrow does not have enough iron to make hemoglobin for red blood cell and cause iron deficiency anemia. The patient also suffers shortness of breath and paleness, is the sign and symptom of anemia. So now we are going to explain pathophysiology of heart failure and etiology. So for the pathophysiology of heart failure part, due to the heart failure occur when the heart cannot pump enough blood to the body needed. So it may due to damage of heart muscle, often caused by ischemic heart disease because of the heart muscle become less efficient and damaged, causing the heart to be overloaded and unable to circulate the blood efficiency. So for the etiology of heart failure part, there are four main causes of heart failure, which is coronary artery disease, hypertension, anemia, and unhealthy lifestyle habits. The coronary artery disease that is the primary cause of heart failure. Due to the fatty substance deposit narrowing the arteries, reduce the blood flow and potential leading to heart failure. For the hypertension, the high blood pressure forces the heart to work harder to pump the blood, which over time can make the heart muscle weak, leading to heart failure. The patient experiences arrhythmia, which is abnormal heart rhythm. Irregular heartbeat can stress the heart. A fast heartbeat increases the heart volume, while the low heartbeat can decrease the blood flow, which leading to heart failure. The lastly is unhealthy lifestyle habit for the patient. The patient who are poor diet, smoking, drug using, excessive alcohol consumption, and lack of exercise increase the risk of heart failure.
In conclusion, a comprehensive analysis of a 64-year-old female patient who experienced increasing shortness of breath and weakness was presented. The patient was diagnosed with both chronic heart failure and colon adenocarcinoma based on the diagnostic findings discussed. The pathophysiology and etiology of the possible diagnosis were mentioned for further understanding and improvement of patients' outcomes.